I'm very excited to be talking about the treatment and the potential reverse of mild to moderate bunions. I think it's very important that we look at things like toe spacers, the appropriate footwear, and most importantly, strengthening the foot. In this video, we are going to be talking about two specific muscles that are incredible stabilizers of the first metatarsal. So first, Peroneus longus. Peroneus longus is going to start on the outside of the foot, wrap underneath the foot, and due to its insertion points along the first metatarsal in the medial cuneiform, it acts as a very powerful stabilizer of the inner forefoot and the first metatarsal. The second muscle that we're going to talk about is abductor hallucis. So this guy lives right on the inside of the foot. And what he does is he adducts, I know that's tricky, it's abductor hallucis, but when the big toe goes straight, he's actually adducting. So what that muscle does when he is active is he's going to help straighten the big toe. So this video is going to show you exercises to strengthen both Peroneus longus as well as abductor hallucis in our patients with bunions. So starting off first with abductor hallucis, what we can do is lift up all the toes, and then we can do some toe taps. So I'm just going to tap my big toe towards the middle of my foot. When I do that, you can see abductor hallucis fire. So again, I would lift and toe tap. If you have bunions or a tailor's bunion on the outside of the foot, you can do the same thing with the little guy. So you would just tap to the outside of the foot. If we wanted to make things more difficult, which I would highly encourage you do once you master that, is to add resistance to your exercise. So this is a toe strengthener from Gait Happens. What we're going to do is we're going to lift up all the toes. We're going to do the same thing. We're going to tap towards the midline, but now I have resistance here. So this exercise all of a sudden becomes more difficult. I can do the same thing on the other side. So oftentimes we'll have patients lift up all their toes, try to spread them as much as they can as they reach the foot forward, and you can really start to feel strength on all sides of the foot. So we're going to be looking at strengthening abductor hallucis to help with the treatment and prevention of bunions. The first thing we want to do is grab a band, and you're going to basically lift up on the big toe. You're simply going to press your big toe into the floor, trying to keep that big toe straight. And as I do that, you can see the engagement of abductor hallucis. If I wanted to make things more difficult, I would increase the vector of the bunion. So I'm actually going to pull the band away from midline. It's going to make it more challenging for abductor hallucis to work. And then from there, I'm really going to try to fight to bring that big toe towards midline. So again, I'm going to be starting over here, and I'm going to have to fight the band to really bring that big toe straight ahead, and you will see good engagement of abductor hallucis. If we wanted to use a banded exercise for Peroneus longus, I'm going to take the band around my forefoot. Peroneus longus is going to evert my foot. So I'm going to have a little bit more tension on the inside of my foot, and I'm going to press the ball of the foot into the band. So again, my foot is in this position, and I'm pressing my toe that way. So I'm getting feedback through the band as I press down and hold. To strengthen abductor hallucis using the Toe Pro, what we want to do is come up about 2 to 3 inches above horizontal. So I am not all the way up on my toe, 2 to 3 inches above horizontal. Then I'm going to evert my foot. So I want to drive onto my big toe, and you want to see or feel the foam compress underneath the big toe. In this position, I am lengthening abductor hallucis, I am everting my rear foot, and I'm going to do an isometric hold here. To strengthen Peroneus longus using the Toe Pro, we're going to place our foot on the Toe Pro so that my foot is more in an inverted position. I'm going to lean into the wall for stability, and I'm also going to lengthen the outside of my body here. I'm going to drive into the big toe. I want to feel the foam compressing underneath my big toe, and I can hold this position for an isometric hold. I can also slowly come back down, control the motion, and then drive into the big toe compressing the foam.